Hey everyone, thank you so much for loving this Physiotrendz all the time. I'm just going to wait for all of you to connect with me and then I'm going to start with the session for today. I'll just post a story on my Instagram as well that I'm going live so that if you want to join, you can join right now. Going live on YouTube. Come join me. Hey guys, so today's topic for Physio Talk, what I've thought is about the what to do during internship, right? Because it's a very common question I get asked from so many students that what exactly we are supposed to do during internship for a better growth in a career, in a profession as a physiotherapist. And that is the same thing we are going to talk today, like what are the things you can do and how you can improvise your skills during internship, because I have always believed that internship is a time of experimenting with your skills. So in first year, normally what we do is we learn about the basics like anatomy, physiology, biochemistry, biomechanics. Second year, you start exploring the pathology, microbiology, and then pharmacology, all the subjects of medicine. Third year, you start with surgery, medicine, orthopedics, assessment learning. Final year, you learn the PT part of it. And now, with all this knowledge and skills, internship is the time that you start experimenting with that. So more and more number of patients you are looking, patients you are seeing, you'll be able to experiment more, and that is going to help you more for your career, for learning, for improving your skills and everything. So many of the time, there are two things that I advise students to do during internship, and actually that is for two different population. Because most of the time what happens is that one set of people wants to go abroad after completing physiotherapy, bachelor's in physiotherapy, and one set of students are thinking about doing MPT, or they are thinking about setting up their own clinic in their towns. So for both of them, there are different things that you should do. So first, which one do you want me to discuss about? Like, do you want me to discuss about the abroad going people, or you want me to discuss about the people who wants to settle in India, they want to do MPT in India, or something else? Let's have answers in the comment section. That what do you want me to speak about first? You want me to put up some poll? Yeah, that's cool. So let me ask you, MPT after BPT or going abroad? So answers you can write MPT or clinic, and abroad you can select. Now let me see what's your answer. Okay, already I've started getting some comments over here. I hope you like this poll section as well. Okay, one person says talk about abroad and two people says talk about India. Still, I'm just going to wait for the answer to the poll. Okay, so we have 67, 75 percentage for MPT or clinic. Perfect. So let's begin with that, guys. Okay, percentages are decreasing. Let me see that. I'll just wait for one more minute to see this. 60-40. Anybody else wants to vote for this? Okay, 67-33 again. MPT or clinic is winning this race. Okay. Okay, guys, last 30 seconds to vote. And then I'm going to start discussing about this, that what you can do if you want to settle in India, you want to start your clinic, or you want to do MPT in India after your BPT. So what you should do during internship time so that your journey becomes smoother and much better. Okay, there we go. Then let's start. I'm ending this poll, or I'll just let it be there. Okay. So, guys, most of you have voted that you want to settle in India, do MPT, or start your own clinic. So, my advice for that, you also know that if you want to settle in India, you want to do MPT, you will have to prepare for the entrance exam of that. And for doing that you must have your basic skills sharpened up, because in entrance exams all the CETs, or let's say private universities like Manipal, NITE, JNDU, all these universities, they have their exams on the MCQ basis. Now normally in BPT time we are trained for writing big answers like 5 markers, 10 markers, 3 markers, but we are not actually trained for MCQs. So that is why MCQs becomes little bit tricky when immediately you have to give exams in that way. So that is why my advice will be that you start working on the basics first. So I have given somebody, like I take live consultations also for people who wants to prepare for MPT. But the genuine advice what I give for everyone is something like that you first start making a timetable during your internship. Like 6 months you have for internship. In this 6 months you can cover all the subjects at least twice or thrice. But we don't want that. We just want that you complete all the subjects once, but very nicely. So what you can do is you start making a timetable for 15 days, give each subjects which are physiotherapy related subjects. So physiotherapy related subjects means you can consider anatomy, biomechanics, exercise therapy, electrotherapy, PT ortho, clinical ortho, neuro, CBR, all these subjects, start preparing for yourself for 15 days. Now, what you have to do is like for 15 days, you have to give each subjects, and after completing 15 days for each subject, you have to start studying MCQs for those subjects. For that, again, you have to give one week time for the MCQs. Like if you want MCQs to get, then there is a book called MCQ book for physiotherapist by Suraj Kumar. So that book is very helpful for all the students who want to go for CET. Also, apart from that, you want to experience higher level of MCQ questions, then you can also study from the books which are for NPTE, PCE. NPTE means National Physical Therapy Examination. PCE is for Canada examination. HAD, MOH. For that, also Susan Sullivan and other authors have given MCQ books that you can refer and understand that from each topic how MCQs are given. And also if you want to experience those MCQs, you can also experience from the Physio Quest series of this channel. If you want link, I'll be providing that in the description below. Don't worry about it. So that is a thing that you can start. So if you go like this for 15 days each subject, in 3 months you will cover up all the subjects and you will have like proper knowledge of these subjects. Next 3 months what you can do is, now this 3 months you have to start applying that knowledge on patients you are seeing. Okay, now how you can apply that knowledge is, you have to just do is evidence based practice. So many of you ask me like, okay, what exactly is this evidence based practice? So evidence based practice, guys, is nothing but it is very simple to practice. You just have to, like for example, common cases what you are seeing in regular basis in your clinics, like let's say for OANE patients, low back pain patients, neck pain patient, frozen shoulder patient, this 5 6 conditions, you just try to find out 5 articles, minimum 5 articles, which are good level of articles. Go through those articles and find out their protocols what they have given in that particular study. Just write down the protocol and start treating your patients with that particular protocol, with documenting the recovery time or whatever the symptoms patient had, everything. Now what will happen because of that, that actually you are performing evidence based practice, and also you will have record of all the patients. So once you document all these things and just go through it once again, you will realize that what all progression you have gained for the patient, or what mistake has been done, or what you could have done better. Okay, and that practice will help you in future when you want to set up your own clinic, or when you are doing MPT and you are treating your patients. So that is something that you can apply and during internship. Now let's talk about that. Let's say that you want to set up your clinic. Okay, and so what else you can do, because this is, we were talking about you have to give entrance exam, you want to go for MPT. Okay, fine. And yes, one more thing I forgot to tell you all, that because MPT you have to do in particular one specialty, So also, and during this 6 months, also think about, like when you're treating patients of neuro conditions, when you're treating patients of cardio conditions, ortho conditions, think about it, that which population you like to treat most, because in that way only you can understand that okay, where you have maximum interest and what you want to do more about it. So that is why find out that interest in this 6 months, so that choosing speciality for MPT also becomes very easier for you guys. Okay, now let's talk about the second situation, which is like if you want to open your own clinic after BPT. uh, that's great, Abhay Kumar. Thank you for joining this. Okay, sorry about that. So let's talk about the second situation, that if you want to continue your setup of clinic after the internship duration, you should go ahead with it. But slight change of plan in this. What you should do is, along with all these things, like you also have to start building your network. And must do thing is, wherever you're doing internship, like for example, you want to set up your own clinic in Bangalore, it is most necessary that you are also doing your internship from Bangalore, because that is where you have to build your network, you have to build your patient population, you have to do some researches, that in which area you should open your clinic, what is your target population, everything you have to identify first. What all doctors are there who can refer you patient? Okay, if you have any friends, or you just start meeting with the doctors around the area and consult with them, that what is their requirement, what do they want from a physiotherapy services, whether they can give you some place or they can refer patients to you or not. Just have a survey kind of thing going on during this 6 months, because my dear friends, I know that this 6 months, apart from internship, you don't have any extra burden to do. So this is like a golden period, golden chance for you all. If you want to do something after that, you can start preparing, you can create a base for that. Okay, along with that, you can start exploring where you can find a place for rental base, or you want to buy, or you want to invest somewhere, from where you can get all the equipments in a cheaper rates. Then everything, you just have to make one plan, you have to note it down and finalize what will be your expenses, and in how much days, how many years you'll be able to recover it, or what is your target, where you want to reach. Everything you have to prepare in this 6 months, guys. So if you prepare all these things, if you plan accordingly in this 6 months, and if you are opening your clinic, definitely you will have a better success in compared to when you are not planning anything and you just start a clinic thinking that okay, we will see after opening a clinic, or after seeing the patients coming, we will decide okay, what else to be done. No, it never works that way. So it is best that you initially plan all these things in the 6 months. Again, I'll repeat the points. First point is, start building your network with the patients as well as other healthcare professionals. Second thing is, start looking for a place, best place you can think of, where you will get maximum population, which will be coming for physiotherapy. Third thing is, start meeting the doctors around who can refer you patients more and more, or they can help you in some other way. Not only referring patients, but some other way they can guide you for getting better clinical practice or something. And the fourth thing is, start making your plan of expenses, from where you will get the equipments in the cheapest rate, what all equipments will be required initially. All these things you plan, and then have a goal, like what you should, where you should reach after 2 years, where you should reach after 3 years, 5 years, like that. Minimum 5 years of goal you should have if you want to set up your clinic. Without that, you cannot give up. Remember this, you should not give up before trying at least for 5 years if you really want to start your own clinic. And if you are working hard for 5 years, I can guarantee you that you will have a very good practice in physiotherapy. So I hope these points are helpful for you all, guys. Next situation now in the poll section, which I asked, like, let's say that you want to go abroad now. Okay, after internship, you have decided that I want to settle in some foreign country, and that's going to be the best thing for me. Okay, fine, that's also a good idea, not bad. Okay, so now you have to decide during internship, or let's say at the end of final year, that whether you want to go for direct work to the abroad, or you want to study some topics in abroad and then settle in the abroad. Okay, in this also, for both the situations I will tell you first. Okay, so let's say, let's talk about the study visa or student visa first. So most of the countries, when you go abroad after BPT, They either give you specialization in one particular topic like exercise science and rehabilitation, or let's say kinesiology, or they give you in strength and conditioning, or there are courses like doctorate in physical therapy, or countries like Australia also gives you masters in physiotherapy. So these are all options you have. Okay. Also some people go for MHA, MPH also. That's a different category. So you need to decide that first, that what exactly you want to do after going to abroad and why you want to do it. Okay. So once that is decided, you have to try finding out the universities which will give you. So first thing is which course you want to do. Second thing is which country you want to go. Australia, Canada, USA, or it is Ireland, UK, where you want to go, that you have to decide first. After that, you have to start looking for the universities in that country and the requirements for getting admission and proper visa. So those everything details right now you will get it from internet. You don't have to go ask anybody for that. You just go to the country and find out the universities which are giving you those courses, find out the requirements and see, like write down, okay, what requirements are there for English proficiency, what requirements are there from the terms of credentials, what requirements are there from the fee structure, what requirements are there for the visa purpose. Everything you will just find out from the internet, note it down and start working on that. Most of the time all the countries require your English proficiency test. So my advice is the 6 months of internship, within first 4 months complete your IELTS preparation or TOEFL preparation or GRE preparation and give exam and get your score achieved. Okay, because if you have score in your hand within 4 months, then you can start working on the all the documentation work. Like you will be requiring your transcript to be done from the college as well as university. You will require other documents to send it to the university, because most of the time in foreign universities they have admission criteria which is between the June to August. Okay, which for that process starts from the May itself, or there is an intake in December, January. So for both the intakes, which intake is more feasible for you, that you have to decide, and according to you have to start preparing your documents, English proficiency requirement, and everything. Once everything is in your hand, you just have to do nothing but send the documents to the people and just wait for their answer. Now, in this, one more thing I forgot, that most of the universities in foreign they also ask for SOP, statement of purpose. And statement of purpose you cannot copy from anybody. You just have to write from yourself, like why actually you want to do that course or why you have chosen that country. So, as I told you, if you are doing this homework, like if you are thinking about, okay, why I should choose this country, and you already have answers, it will not be a big deal to write down SOP for you all. So if you go through this system, then you can easily prepare, you can utilize your 6 months of internship for going abroad. Okay, and last 2 months you can do this documentation work, and by your internship is finished, you already might have your admission letter in your hand, and within next 2 3 months you can go to the abroad country without wasting 6 months or a year. So that is what you can do if you want to go for a student visa. Next possibility is that you want to go directly for work visa or working in foreign countries. Okay, now foreign countries, if you want to go directly working right now, there are no foreign countries which are giving direct work permit to the physios after BPT. They at least have minimum requirements of 6 months work experience or 1 year experience. Some countries also have 2 years of work experience. So my advice is that in this during this 6 months of internship, start planning where exactly you can start getting a job, which experience will be useful for you to get a job in foreign countries. It is much better if you can get a job in a multidisciplinary hospitals. Okay, why multidisciplinary hospitals? Because there you can get exposure to all the kinds of cases, and which will make your CV very strong for applying in the foreign hospitals as a physiotherapist. Okay, and it's not only that easy, because applying for the foreign countries also requires license exam clearing. Like for example, UK is a country where you can directly go and work with a 1 year of minimum experience, but that requires HCPC registration. So after 6 months of internship, you can start with the procedure of HCPC. So it will take almost around 3 months to get finished, and after that, more 6 months of experience, and you can apply for the jobs in UK. Same way, if you want to go to UAE also requires 2 years of minimum experience. So along with that, you also have to give HAAD hard exam, MOH exam, or DH exam, depending on where you want to go. If you want to go to Dubai, you have to give DHA. If you want to go to Abu Dhabi, you have to give hard exam. If you want to go to Qatar or some other countries, then you have to give MOH. So just look for these exams. What are requirements are there for these exams? Learn your basics. Again, improvise your skills so that you are already set for giving the examination, and that will help you to clear the exam in one go. And after that, you can also apply for the jobs in this situation. So guys, directly work also is not a bad idea, I would say. Only thing is you have to take care of these things, like which country you want to go and what are the minimum requirements for those countries to go directly on work. Right now you have opportunity in Canada also, like you can give PCE examination from sitting in India or whichever country you are right now. Once you clear the exam, you can directly apply for the work visa for that country. For that, minimum work experience is not required, but PCA clearing, theory part of the PCA has to be cleared. That is most important thing. So that is also an open option for you all. So what I am saying is, this internship time you can utilize maximum if you know what you want to do after BPT or after completing internship. So the first thing today, if you are in internship, just define that what you want to do after internship and start working towards this goal. Okay, now if you have any other questions, you can start asking in the comment section. I will try to answer those questions, and after that we can finish this live session. I hope you guys had fun and you learned something important in this live session. So just give me your questions if you have any, and I will try to answer that. Abhay Kumar asked me that clinic versus abroad, which has more money making potential for going abroad to work directly? Canada, for example. What about initial investment cost versus ROI? Okay, return of interest. I get it. So, Abhay, the thing is, clinic versus abroad. See, I think I mentioned this before also, that wherever or whichever the path you choose, you have to decide that first 3 years are going to be a very much struggle, whether you open your clinic or whether you go to abroad country. Okay, talking about investment for each thing is almost like around 20 lakhs to 25 lakhs, I would say. Because if you want to set up your own clinic, you require space, you require equipments, you have to do marketing and stuff, so that is going to cost you money. If you want to go to foreign country, you have to have like work visa, student visa, you have to pay tuition fees, you have to get cost of staying over there, and other expenses will be there. So all this thing, like you can say that investment is around 25 to 30 lakhs for both the things. First 3 years are going to be a huge struggle because you are new to that place as well as you are new to the clinic. So you have to build your repo. So if you are very much interested, if you are really keen on doing that and you are struggling for 3 years, after that you will start getting your return of interest. And return of interest in both the cases is very nice, because if you are in foreign countries, you get better weather, you get better like I would say lifestyle, you get better people, and doing job in abroad countries are much better in compared to doing job in India, of course. Okay, now if you're settled in India, you have started your own clinic. As I told, 3 years are going to be struggle, but after 3 years, if you are skillful, if you have skills for it, if your patients are very happy with you, you will start getting regular number of patients, you will start earning good amount of money. If you have developed your management skills, business skills, everything is there, then again here also you are going to get return of investment very nicely. And here advantage is that you'll be staying with your family, you'll be having social life plus work life, everything. So it's kind of like both the way you have better life. You have to choose that which one you want more. I hope this satisfies your question. What course should we consider for Canada? So guys, for Canada, normally they all have, like mostly they have diploma courses. Like if you go through the Canada universities and everything, after BPT they mostly offer you diploma courses. Also they have MPT, but that is not much advisable because that cost you too much, way too much. So nobody will advise you to go for MPT for that. So most of the people, what they do that nowadays is for Canada, they will take a diploma course in strength and conditioning or kinesiology, or I think so. Most of the people go for exercise science and rehabilitation. After that, they just get 5 years of visa, like 2 years of study and 3 years of work permit, or 2 years of work permit. In that duration, they just apply for permanent residency, they become PR, and meanwhile they also prepare for the examination of PCE. So within 5 years they will get PCE cleared as well as PR cleared, and they will also start earning in Canadian dollars. That is how mostly people do, like I have observed doing my with my students as well as my friends. So that is a way you can continue with the Canada. And Canada, you don't see, basically studying over there is something like, after BPT you will feel like you are studying something lower standard, because BPT curriculum in India is much 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 better in compared to diploma courses over there in Canada. So from study perspective you don't get more advantages, but the only thing is, yes, you will be in Canada, you will get some exposure in Canada, and that will help you for clearing your PCE examination. That is the only advantage I see over here to go and study in Canada. Sir, I just came in second year. Some tips, buddy. In second year, as I was talking about, you have certain subjects like pathology, microbiology, which are again important, pharmacology. So I would say that focus on those subjects, and try to make sure that you understand the subject and don't try to mug it up just for the exam purpose, because these all things, pathology, microbiology, is going to help you in future when you are studying about the PT management of the condition, because if you know the pathology of the condition, then you'll be able to treat it much better way. uh, you're welcome. How important is it to do MPT in India, or one can do good even with the bachelor's degree? Kajal, nowadays the thing is that doing MPT is kind of like a basic most necessary. I'm not saying that without MPT you cannot have a better career in the clinical setup. No, it's not like that. But like if you look at it this way, that you're if you are a patient, if you're going to a doctor, will you prefer just BPT, or you will prefer MPT who has some years of experience? Obviously, people have that tendency that who has a better degree, they will have a better scope of training. But again, that's just a one point of view. Another point of view is that if you have got skills, if you are very good at what you are doing, doesn't matter your BPT or MPT. So I would say that also another option is like you can do some fellowship courses after BPT. You can do some courses which can improve your skills after BPT, in which you want to work on. And then if you are doing that, that also might help you for better setup, clinical setup, if you don't want to do MPT. Okay, so it's a choice. It's not like must do things. Okay, next is what about clearing interviews on location through tourist visa and local connections? Buddy, that is possible, but again, on tourist visa, I think so only, and all the foreign countries requires you to pass certain examination or some registrations. Okay, like Ireland is there, you can directly go and work, but you require to have CORU registration, CORU registration. So without all these registration processes or exam processes, don't get trapped by somebody that okay, I'll get you directly job in that particular country, because you must understand that minimum requirements you have to fulfill as a foreign practitioner. Without that you will never get a good job or something like that. How to approach doctors for recommendations? Well, directly just be confident, be what you are, and just go and explain them that what are your skills, from where you have studied, and what is your vision for your patients, how you can help their patients in a much better way. And if you're successful doing that, then I think they will definitely recommend you for more and more patients, because doctors also think that their patients should be in safe hands. If patients are getting benefited, then they will be happy to share their references to you. So you just have to make sure that you make a doctor, like you gain trust of the doctor, that yes, this person will be able to handle my patients in a good way. So both the parties will get benefited, patient as well as doctors as well as you. What is best for us, own clinic or job? Well, longer time, if I talk about, like after like 5 years, 10 years, it is best if you have your own setup rather than working for somebody. That's how I think. I'm in class 12. I'm looking for making my career in physiotherapy. That's great. But honestly, I don't know why I think that this career is not for me, or simply how would I know I'm interested in physiotherapy. Buddy, well, you are in 12th standard right now. I say you must be having exam in few more days. I would say right now concentrate on that exam and everything. Once your exam is over, just go through and try to meet physiotherapists around your place and see how they are practicing, what is their point of view, and then you can decide from their advices and looking at other physios how they are doing, what work exactly they do. You can decide whether you are interested in that or not. You're welcome. From AIMS Institute, how much NEET score is required? For every year, NEET score requirement changes, but I would say for physiotherapy, you have to aim at least for 200 score. That would be the best one to get in any university. Initial salary after BPT, this is a very tricky question and tricky answer, guys. I have made one video also for this. You must look for that. But yeah, initial salary right now, if I talk about part-time physios, get something around 6 to 8 thousand, and full-time physios get something around 10 to 12 or 14, 15 thousand per month. But I would say don't look at it that way. You can also earn money if you have home visits, if you have your some other skills. And initially, as I was mentioning before also, first 3 years, guys, first 3 years you have to struggle. Without struggle you are not going to get everything. So please don't think that from the first day itself you should start getting 50,000 salary. If you are thinking that way, it's always going to hurt you, because initial 3 years you have to show people that what are you, what are your skills, what are your strengths, how you can help them best. So that duration, yes, I know that physiotherapist salary is quite less, like in compared to what do we work. But then again, in this world of competition, you have to show your potential first, and then you can demand for more salary. That is how I think. I'm sorry if I have hurt anybody's sentiments with that. What is your viewpoint of chiropractitioner and from where we can do? Okay. Now, this guys, see, chiropractioner is completely different thing from what we do as a physio. See, we physios work in muscular imbalancing. We physios work with body alignment. We physios work with movement analysis, posture analysis, everything. We are not bone setters, guys. You just have to understand. See, chiropractic, if we understand, it looks good when you look at it, like you, it's fascinating, it's a fancy treatment, but that is not something which gives you permanent result. Okay, if you need a permanent solution for the pain or something, you have to have muscular balance, and that is possible only with skillful physiotherapy exercises. So I would say that if you are a good physio, if you have understood the basic concepts very nicely, then you don't need this chiropractitioners. So don't fall in that trap directly. Rather than you have better techniques, like in manual therapy, you have studied about McKenzie, you have studied about Mulligan technique, you have studied about other techniques, Carlton bone techniques. All these techniques are utilized for this purposes. So just focus on that, improve your skills about this. Automatically, you will cope up with the patients. Next is, sir, which subjects and topics we need to give more emphasis for AIMS Junior Physiotherapist exams? As I was mentioning, for any CET examination or entrance level examinations, you must have basic knowledge about all the physiotherapy subjects. It can be anatomy, biomechanics, it can be X therapy, electrotherapy, then your assessment skills, PT neuro, clinical neuro, all these things. All these subjects have to be a very good thing if you are going to give that exam. I know it is on 26th of March or 27th of March. If you are giving, all the very best for that. Sir, is it good to do MPT just after DPT, or one should take it? Komal, I'm glad you asked this question. Today only I have posted a short video on this, that why you should not take a gap after DPT if you really want to do MPT. So I would advise you that don't take a gap, and why should not take a gap, that you can find out in that short video. So please tell me detailed treatment of kyphoscoliosis. Life hack, I would love to tell you that, but this live session is purely about like what to do during internship. Maybe some other time I will be explaining you about this, or you can directly message me. I will try to explain you that treatment for that. What do sports physiotherapists do? Please describe a little more what actually they do. Okay. Rachit, sports physio is again a specialty just like a neuro, ortho, cardio, any other thing. But being a sports physio, you have to be more active because you have to deal with the athletic population. So what exactly is their work is they have to make sure that the athletic population are not having any problems during training as well as playing sports. Okay, so both the things we are taking care of. So it is like on field work as well as you have to work with the rehabilitation or during the training phase. So during training phase, coach will be there, nutritionist will be there, as well as physio will be there to look for the alignment changes in the body, or if athlete is getting any niggles or any pain, how to deal with that, how to modify their activities and make them stronger. So that is all things. So again, your basics needs to be on the toes for this also. Okay, so there are many more things in that sports physio. Actually, I cannot explain everything, but yeah, I'll be providing one more link for that. You can just look for that. Sir, I am good in explaining things. So, if there are any chances to be professor, and is MPT compulsory for that? Yeah. Yes. If you want to have a career in academics, then definitely you require MPT in particular specialty. Then only you can become a professor. Professor actually is like in a senior post, you can start always with a lecturer post or assistant professor post, and then gradually with experience you can become professor as well. And if you are good in explaining, definitely you should go in academics. And you have many other options also, like how I am doing. I am also a professor, but I like to connect with the students all around. So that is why I have this YouTube channel, Instagram page, where I regularly connect with you all, and I just discuss about like how I can help you for your career and best future advices. So it's always good, guys. Sir, which new workshop course you are bringing? Also, can we know about it? Uh, Recently, actually, I have posted that I'm going to come to Gujarat, Gandhinagar. I'm bringing Kiran Satpute sir for the Mulligan concept mobilization. He is authentic, I would say, the practitioner, Mulligan practitioner educator, like official Mulligan practitioner educator who has studied under Mulligan, Brian Mulligan sir, and he will give authentic certification which is internationally like it can be validated. So he's coming up with the module A, in which he's going to teach you all upper limb as well as cervical spine Mulligan concept, movement with mobilization, in 2 days of workshop. So that is my next workshop, which is coming on 25th and 26th March, which is in Gandhinagar, Sharda College of Physiotherapy. So yes, I am also going for that. I am also going to learn that from Kiran sir, because I want to be a Mulligan practitioner as well. So I'll be there in Gandhinagar for that. And yeah, many more webinars and everything I'm going to continue, because you must have seen that recently I was doing biomechanics webinars. I have completed basics of biomechanics, muscle structure function, joint structure function, biomechanics of spine, biomechanics of gait. In future I am planning to bring a little bit more practical workshops. The next one I'm planning to do is about x-ray investigation or MRI investigation for spine. So looking forward to that. Soon I'll be starting with the advertising of that. If you're interested, just stay connected with me on Instagram or YouTube. You'll get the notification for the same. Are there anyone who can properly guide for studying in Canada, which diploma course and PCE? Yes, Bhakti, actually, I know a person who is Physio Neha. I think you can connect with her. She is in Canada. She helps students for Canada admissions as well as PC credential, everything. Also, there are some agencies like PC Study Buddy or Final Frontier. They help students for all these purposes. You can just check about them on the internet, whichever suits you. You can directly connect with them. सर प्लीज़ बीपीटी स्टूडेंट्स के लिए कोर्स रिलीज कर दो, बहुत ज़्यादा प्रॉब्लम होती है हम लोग को, प्लीज़ सर फर्स्ट ईयर से फोर्थ ईयर के लिए प्लीज़. I am doing my best, guys. Like, if you have gone through my channel, you will find out that I have posted so many videos which can help you in first year, second year, third year, final year. And also, if you're practicing physiotherapy, it might help you, especially the Physio Quest videos. I know they are not much popular, but if you go through those videos, you will learn so many things, guys. So I'll advise you that you just go through both the PhysioQuest series, PhysioQuest 1 and 2. I think so most of the conditions I've covered in those, and that also in the MCQ pattern. So it will be interesting for all of you. Uh, yeah, it's so can we still register for that workshop? Yes, Bhakti, you can register for the workshop. If you need more details, you DM me on Instagram. I'll send you the details. How will be connected with the people and get visit, guys. For that you just have to start working from some point. Once you start working, you will start getting recommendations from the different population. You will make your rapport with the patients. They will only refer you more and more patients. Can we do our internship for around 1 year, like for 6 months we are doing from a place, and to improve our skills more, can we extend our internship more 6 months to another place? Jaisha, that's not ideal, I would say. 6 months internship you complete first, and after that next 6 months you can just spend some time in some hospitals to learn and experiment more. But I would not say that to be as an internship. You can start working, I would say. Just start working, and then you will realize, okay, what are your strengths, what are your weakness, and start working on the weakness. Is there any way we can access to your earlier webinars? I'm sorry, I'm not giving any recorded videos for that, for some reasons. But yes, I'm going to repeat those webinars soon, after once the whole series is completed. So I would say just stay tuned with me, and I will keep posting about the if any webinars I'm repeating for the same. We may all think about the future. Please help. While doing BPT, we may think, yes, future. I didn't get your. ओके। वर्कशॉप पटना में कभी लेकर आओ आप सर, यहाँ नहीं होता। बड़ी आई एम श्योर आई जस्ट ट्राई माई बेस्ट, but as I have informed before also, Patna, Delhi, I want to come, but I don't know many of the people. If you can come up with a group of people who are interested doing in this particular workshop, definitely I'll do my best to arrange those workshops for you all. During internship, how do you get paid? Okay, there are few things you can do during internship. Like during internship, start working extra. Like after internship hours, you can start working with some clinic for part time, or you can start seeing some patients with the help of your seniors, or some guide who is guiding you for assessment as well as treatment purposes. And that will be the best way to start earning, I would say. And apart from that, you have now digital platforms, many other opportunities as a physio you can do to help others as well as to yourself. How to study biomechanics? Biomechanics is very interesting subject, my buddy. And if you want to study biomechanics in a proper way, just start with analyzing all of your movements, just daily movements, in the perspective of biomechanics. Like for example, I am performing this elbow flexion. So for that, what all muscles are working for stabilization, what all muscles are working for movement. If you start analyzing this on yourself, on others, when they are walking, gait, posture, everything, your biomechanics is going to be super, super, super cool, and you will be having very good interest as well in the subjects. So my advice is genuinely just start analyzing on the daily base of life, and your biomechanics is going to be awesome. And yes, of course, you can join my webinars for biomechanics. That also will help you. Yeah, I know I have to do my advertisement, right? Some or the other time. How you decided to make your career? Okay, I think I have decided. I have told you this before also, that I had no idea why I started physiotherapy. But once I started, now I cannot think about anything else. So how decided, for that I don't have any answer, but now I know that this is what I want to do for my life. Okay, guys. So thank you so much. Yeah, it was a wonderful session. So many questions you asked, and I hope that I have done justice to your questions and I've answered all your questions. Why mostly medical university not allowed to say physio doctor? That's uh, that's okay, I would say. Just call yourself physios, okay? And why they are not allowing is, like, there are plenty of reasons, Pankaj, for that. Like, see, the thing is. being doctor or being called doctor, that creates so many confusions for normal population. Because let's say that you're writing doctor in front of your name, you're traveling somewhere and some emergency comes, like somebody is getting heart attack or something, you say that you are a doctor. Will you be able to be like first care of treatment or provide first care of treatment? No, right? It can be a difficult thing for people to identify those things, so that creates a slight of confusion. There is nothing wrong in saying, because see, we are studying all the subjects, we are studying equivalent to doctors. I cannot deny that. Only thing is we cannot perform surgery, we cannot prescribe medicines. So you want to use doctor, that's fine, but also use PT after your name, physiotherapist, so that will not create any confusions for the people, and then we can balance the situation as well. बिहार में इतना कम क्यों दिख रहा है? एजुकेशन सिस्टम बहुत ज़्यादा ख़राब है, बेसिक भी नहीं पता है उन लोग को, फिर पढ़ा रहे हैं, क्या करो? अब मैं I'm really sorry to hear about it, buddy, but I would say that don't just rely on them. Start learning, start getting educated from wherever you can. Now we have advantage of this internet and everything. So find good mentors, good people who can teach you basics and teach you physiotherapy more and more, and just go with them. You just try to learn from them, and just stop worrying about what you have right now. Because if you have a zeal for learning, and if you are learning from some other places, you will have a good career. Don't worry about it. अरे जो भी बोलते हैं, पर अपना तो काम पेशेंट को अच्छा ही तो करना है. यस यस यस, डेफिनेटली अपने को अच्छा ही करना है. Okay, guys, thank you so much once again. I'll end this live session now, and I will see you all next week again with this Physio Talks live session. I'm going to continue this. I want to continue this, and I need your support for this. So keep supporting Physiotrendz, and keep sharing these videos with your friends and physios for more and more reach, and building a strong community for us physiotherapists. So I hope you will have a great Sunday tomorrow. And once again, thank you so much for being here on this session. I'll see you next week with another topic on Physio Talks with Physiotrendz. And if you are not subscribed till now to my channel, please subscribe. This will motivate me to do more and more videos like this. Thank you. Other questions I'll try to answer next time, please, guys. So sorry if I have not answered your questions, but stay tuned. Bye bye. Thank you so much.